All right, good morning, everyone. It is March 22nd, and this morning we've got some housekeeping work to do on S204, and then we'll move on to learning about H720 and H711 after that. We also have Monica White, Commissioner Dale, that we could vote on when we get a minute. So it'll either be today or.
I have learned Justin. Pardon me? I have an appointment too.
Okay, so we'll put that on the agenda. Maybe let Aaron know, and then he'll get it on the agenda. Anyone else who has an appointment, just let Aaron know and we'll put it on.
I gotta do that.
Reminder, I know.
The panic will set in the last week.
They're always working at their jobs.
Everybody's working hard.
Well, we confirmed people that Shumlin had appointed, but then Bill had appointed somebody new. The change of administrations get really slow.
So Senator Hardy, Jen Carby is on the floor right now with Bill,
Okay.
House Bill, and I'm wondering if, S204 has continued to be problematic. We've worked as hard as we could in our bill that we passed out of committee. We had a good vote on that bill, I think. Was it unanimous?
Yes.
It was a unanimous vote, and so I think, we felt comfortable with that bill because it allowed for birthing centers to go forward, but that then at the same time for the Green Mountain Chair Board to evaluate how and if and what to evaluate for any kind of regulatory piece going forward. And then we have continued to hear from folks in the birthing center world that they would like to go back and remove sections 4 and 5 and go back to a full exemption from regulation, and in particular the CON. And my concern is that we've hit a brick wall on that. I mean, it's unfortunate. I would like to see some kind of licensure in place for our birthing centers. And Ruth, Senator Hardy, you've worked really hard on this, and I said thank you for the work that you've done. And you do have a proposal of amendment, so maybe you would share that with us. We have it on our webpage.
Yeah, so thank you, Senator Lyons. It is on our website, and I can provide a little bit of background before going over it, and Jen can give more detail, but I can tell you what the amendment is intended to do, but
Sure.
Yeah,
just what does it do?
Right. So as you'll recall from the S204, as we passed it out of committee, it would create a sort of two-step process. There would first be a statewide health resource allocation process review, or an HRAP review, that would look sort of statewide at the health resources around Vermont and identify areas where there's a need for birthing center services, either a region or a population. And the examples that we've tossed around the committee all the time were, Rutland County, maybe because there aren't midwifery services currently available in Rutland County, and then potentially new American or immigrant populations who are not well served by hospital birthing centers, or not comfortably served by them. So those were two examples. I don't know if those are actual reality, but those would be our examples of what they may find with an HRAP process. And it was really, the intent was to make sure that there wasn't conflicting services or duplication of services, especially because our state is so small. Our hospitals and healthcare services are under so much stress right now, and because our birth rate in Vermont is so low. And I have not yet had a chance to get the exact statistics. I will for the floor report, but our birth rate is so low, especially in some areas of the state, that there just aren't enough people having babies to have duplication of services. And we don't want to create a situation where there's a lack of services because of hospital going out of business or something. So those were the things we were trying to address with the HRAP process. And then they would also report back to us next year and give us a report on what they found in the Green Mountain Care Board in consultation with the Department of Health Maternal Child Division and the Blueprint Maternal Health Program. And then they would also make a recommendation about whether or not birthing centers should have to go through the CON process. And just to be clear, there's been a lot of confusion, but I got it clarified yesterday with the Green Mountain Care Board. Because birthing centers are a new healthcare project, they do not exist in our state currently. They would automatically have to go through the CON process. The original bill exempted them from the CON process. But if we are silent to the CON process, the assumption is that they would have to do a CON because they are a new healthcare project. And that's what I was told by the Green Mountain Care Board, is that they would consider them new. So what the bill did was to create sort of first the HRAP process and then a recommendation on a CON. The assumption would be a CON because that's current law, unless the HRAP process said no CON. So that was what the bill was when it came out of committee, created the licensure and all that stuff. So the proposed amendment, which I worked on out of request from several members of the from a member of the committee to try to find some kind of middle ground between the HRAP process and the CON process. So this is what I was able to come up with the help of Jen Kirby. And so it's on our website, but it would have the HRAP process as it was as passed by our committee. And it would break down specifically what they would be required to do. So it's drafted a little bit differently than in the bill. And then it would make a recommendation. It would have to identify the specific regions or populations and make a recommendation about the CON. But notwithstanding the CON process, the areas of the state where there's an identified need based on the HRAP process, or the populations where there's an identified need, birthing centers to serve that region or those populations could go forward without a CON, without a certificate of need, for 3 years until July 1st, 2026. So the report would be April 1st, 2023. They would have until July 1st, 2026 to create birthing centers in those regions or to serve those populations without a certificate of need. All other birthing centers would have to have a certificate of need. And then after 2026, July 1st, 2026, all birthing centers, regardless of where they are, who they serve, would have to have a certificate of need. So this was an attempt to find a middle ground by having some that would be able to move forward without a CON and some that would have to still have a CON depending on where they are and who they served. So that's the amendment. Like I said, it was just an attempt to try to find a middle ground, and that's where.
Yeah, good work. It's a lot of work. Well, it does essentially establish a new process for a healthcare facility. It allows for the HRAP to become a process for the birthing centers. And I also heard from some folks who'd like to be included as a stakeholder in the group discussion. But so I don't know, committee comments.
Well, one other thing.
I'm
Sorry, I just remembered when you said that. The process as it is in the bill would be with Green Mountain Care Board, VDH, and Blueprint. The amendment also adds the Hospital Association and the Midwives, American College of Midwives, the Vermont affiliate, to that sort of consultation process.
Yeah, I've heard from the Vermont Medical Society that they'd like to be consulted.
Of course, once you start,
the more you start, but once you start, you can't end.
Yeah.
So other interested parties are important. But
and I know there are concerns that this creates a new process. The bill, frankly, creates a new process as we pass it out.
Exactly. Yeah.
So you know, I guess it's just a question of whether we want to do this at all or just,
Well, here's my thing, I don't know, let's let everyone sort of, why don't you guys weigh in a little bit on this, and then I'll say one second.
Well, I agreed to support this as a way to quell the mutiny in my committee. I will say I'm still dealing with that violation of the rules, and I have a hard time rewarding people for bad behavior. It's very bad parenting, in my experience. There is another issue which has been brought to my attention, and that is we do charge a provider tax for
Oh,
any place that has a bed.
yeah,
And so I'm not gonna bog this bill down, but it will be something I'll look at in miscellaneous tax.
okay,
Can I ask a question to?
yeah, no,
Senator
please
Cummings'
go
comment?
ahead.
What is a provider tax?
Oh, you,
Yeah,
Roll a tax.
It's a tax, it's a fee that is put on a bed, basically. It's been called a bed tax, but on the number of beds you have. The theory when it first went in is it gets returned to the hospitals in the form of higher Medicaid payments. There's a complicated formula and the feds did catch on. So there can't be a direct connection, but basically it's a way because we get federal money to pay roughly two-thirds, but a percentage of the Medicaid payment. So it brings down more federal money and then we can pay higher rates back to the facilities.
Okay. And just in regards to the bill, thank you, Senator Cummings, for that. That was helpful. I went 6 weeks ago or a month ago from not even knowing what one of these things was to supporting it. And I was pretty happy with the bill the way it was. So I think my position is I'm pretty happy with what I voted on before. So whatever the committee needs to do, what we need to do. But I thought we were moving forward with that, so.
yeah, I hear a similar comment from Senator Cummings about not rewarding bad behavior. Senator Hiller.
I missed.
Yes, because I've been
I don't know.
talking to Senator Harry and really appreciate
Yeah, I
what
know.
she's done. My question is, do we need both sections of the bill? One that says you automatically need a CON and the other one that says we're going to look at this as a statewide need and allow the Green Mountain Care Board to go through the return process so that we can determine where these are. Nobody wants to put hospitals at risk. Nobody wants to do that, but it seems kind of contradictory in some ways because I know Senator Cummings is very concerned with the fact that these birth centers need to be near a hospital for emergency situations. And, you know, I certainly can agree with that. You don't want to put anybody at risk. But also that, you know, there's kind of forces talking, it seems to me, the voices talking against one another when we can't have it because we don't want to jeopardize the hospital, but we can't have it unless it's near a hospital because it needs to be there. So there's kind of that contradiction.
And not just a hospital, but a hospital with OBGYN services, which is what's not guaranteed. I don't want a neurosurgeon messing in my placenta. I'm sorry.
So Senator Booker, you're looking at the bill that we passed out
I'm
of
looking at
committee.
the bill that was passed out of committee that had and
Yeah, I
I'm
see.
wondering,
And
is
you're
that
looking at
part of
section
it,
4.
Section 4?
Yeah,
Is that part of it going to be eliminated in favor of the section 5 that says the Green Mountain Care Board is going to look at this, going to determine whether or not a birthing center is, you know, where they can be located. And those that they say, yeah, there's a need here, there may be a need, whether it's in an area where there are a lot of new Americans, or if in a place where there are no midwifery services, then, okay, go ahead, but the rest of you, you're gonna have to go through this process that.
But your interest is in taking out section 4.
I just think it would make it cleaner.
Well, this is something that we would have to talk with ledge counsel about specifically, and I'm gonna leave that in Ruth's hands, Senator Hardy's hands, unless you would like me to do that.
I think we need section 4 in the bill because I think that there needs to be clarity about the CON and the fact that there would be a CON required for birthing centers unless there was an identified need during the HRAP process.
You've stated that there is that clarity in the statute that.
It's not called out as clearly as it is in section 4. So that I think having that in there, then legislative intent is clear. And so the Green Mountain Care Board doesn't get in the position where they're like, well, we think they need a CON because they're a new service, but it's not listed in statute.
We want to quell all the debate. When the bill left the committee, we felt that we had done a good balance to the bill and to the issues before us. So without putting in place a full-blown CON going forward, and without putting in place an exemption for that, we really have defined what we think should have.
I think to the question of, should they be where hospitals are or not, is one of the things they would look at in the HRAP process. And that's one of the reasons why there's consultation with the maternal child health people, because they're the subject matter experts in terms of what is necessary services in order to be, safe and to be providing good healthcare services, and that's why.
So I'm thinking, we have the bill up on the floor as we passed out of committee, and it went out of here with a 5-0 vote. We're trying to ameliorate the concerns that we're hearing in the hallway and on emails, and that I'm not sure that isn't going to continue regardless of what we do, even with the proposal that Senator Hardy's put together. And we still know that there are people who are interested in commenting on the new amendment, because it's a new way of looking at placement of facilities across the state. So I am leaning toward the bill that we passed out of the committee. And I think if we want to, if the committee feels it's worthwhile, we certainly could step back and take testimony on this proposal amendment. We could bring in all the interested parties and do that. But I'm going to let you know that's not going to happen for a while, because we've got other bills that we're trying to work through. So we would have to pass over 204. I'm considering I'm not yet at the point of bringing it back into committee, but that would definitely kill the bill, and I'm not interested in doing that, because I think the licensure is so important, and the birthing centers are so important. But I would consider ordering the bill to lie, and I may do that, but we'll just have to. Oh, there she is, bless her heart. So we will, so we're just going to have to decide as a group how we want to go forward.
And just with clarity, midwives can function in this state. I don't know why Rutland doesn't have, they may not be part of the hospital, but you can have a home birth. I remember when we did the licensing or and I think there are standards around the hospitals and distances, and so it's not that people are being deprived of midwifery. The concern is that if we open up a separate facility with beds and labs and whatever, that the report we got from Green Mountain Care is, even if they only take 3 or 4 births a year out of a local hospital, that could be enough to cause that hospital to shut its OBGYN services down, because they've only got 8. So we're working on finding a better way, the global budgeting, and part of that's gotta be what it costs to provide those services. But if those hospitals go under, whole sections of this state are deprived of emergency hospital care. You already have to drive from, I believe it's Newport to Dartmouth for chemotherapy. That's pretty horrendous, given the side effects of some chemotherapy. And I think that's the balancing concern. And the behavior on this one, this is the worst I've seen.
I haven't seen this, well, you know, it's, people have been out of the building. Now they're back. Fair game.
Rules have been forgotten.
I have to say, I, for one, up until 45 minutes ago, knew nothing of this issue.
Yeah.
Sure.
I didn't get any emails, phone calls, no one stopped me in the hallway. This is all new to me that we're even
Yeah.
having this conversation, so.
Well, I had 2 members of my committee. We had Bill in because there's a $300 licensing fee. That is the jurisdiction of the finance committee, is the fee. The unwritten rule of procedure in this building, and one of my miscreants guards his bills like a junkyard dog from having any other committee touch them. The rule is that you only look at the section of the bill that you have knowledge and expertise over, that's in your jurisdiction. The motion at 3 o'clock, 4 o'clock on Friday was that we strike out of sections 3 and 4, the sections that had to do with the CON. My committee had taken no, and I don't know that the people making it realized they would pick up 2 other votes for various, I think, unrelated reasons. But it passed. And so it was only Senator Hardy saying, wait a second, I've got it. And it was rather awkward to reconsider and redo votes. People backed down. But that wholesale, no warning to the chair, no warning to the members on the committee that were in health and welfare, that this was coming, was really a gross violation of just the way the Senate operates and the only way it can operate. And so the agreement was that this compromise would be presented and that Senator Hardy and I would support it, which got people to back down in my committee. However, the bad behavior still remains. And
We aren't asking you to support bad behavior.
And this was late on
try
Friday.
not to.
So,
Yeah, you didn't hear because
Yeah,
it
no,
was
I'm
4
not-
o'clock
I'm not-
on
I'm not
Friday.
upset that I didn't hear anything. I'm just saying that I didn't hear anything.
right,
This is all
well,
news
so,
to me.
no, but the
Well, I haven't heard
rules in
anything.
rules in the Senate are pretty clear that you only look at the sections of bills that pertain to your jurisdiction.
Right,
So,
when
yeah.
I took S90 appropriations, we only talked about the money piece.
Right.
Exactly,
Right.
yep. And appropriations have a little more latitude because of the way they work, but they're interactive with.
You try to be respectful.
Yes, they do. Jen, Senator Hardy did talk through her proposal amendment. I think it might be helpful for you to go through it, and then there may be some questions about the underlying bill as well.
Okay, yes, Jennifer Carvey, Office of Legislative Counsel, excuse me for the record. So we are looking at S204. I'm just pulling up the language. I don't think I printed out a new one for myself. So this is draft 1.2 of a potential amendment to be offered by a senator to be determined later. Would amend the report of this committee by I ultimately ended up striking out all of section 5 and putting it back in with some changes to it. So that's the one on the Green Mountain Care Board conducting the needs assessment. This would have still have in connection with its responsibility for developing and maintaining the HRAP, that the Green Mountain Care Board, in consultation with, we still have the Health Department's Maternal and Child Health Division and the Blueprints Women's Health Initiative, but it would also add the Vermont Association of Hospitals and Health Systems and the American College of Nurse Midwives Vermont affiliate. So the board, in consultation with those stakeholders, would conduct an assessment of the need in the state for the obstetric and midwifery services offered by freestanding birth centers. Now we're back to the language that you passed. And the assessment would still include evaluating the need for the services in particular regions of the state and for certain populations of Vermont residents. Would still have the report coming to this committee and House Healthcare by April 1st with the board's findings and recommendations about the need for services of freestanding birth centers in Vermont. And I've now separated these out into individual subdivisions. So in 2 and 3, pulling out specifically the specific region or regions of the state, if any, where the board found a need for the services of a freestanding birth center, the specific population or populations of Vermont residents, if any, for which the board found a need for the services of a birth center, and then the board's recommendation about whether people seeking to establish a birth center should be required to get a certificate of need. Then there would be a new section, section 5A, that would say notwithstanding the provisions of 18 VSA 9434A as amended by section 4. So that's the one that would affirmatively require a CON for birth centers. Notwithstanding that, a person seeking to establish a birth center on or before, and I have here July 1st, 2026, which would be 3 years from the date that the CON requirement takes effect. You could pick a different date. But they would not be required, if they're seeking within that period to open a birth center, they would not be required to get a CON if the birth center is proposed to be located in a region of the state or to serve a population of Vermont residents or both, for which the Green Mountain Care Board identified a need for the services of a birth center in their needs assessment report. So we have that report in section 5. If it identifies certain regions or populations of the state or both that could use the services or need the services of a birth center, not just use, but need, in that needs assessment report, then somebody seeking to open a birth center to serve that area or that population or both within the first 3 years would not have to get a certificate of need. And then section 7 just makes a conforming change to add the exception, section 5A, to the effective dates on the same date as the other CON requirement would take effect. So July 1st, 2023.
So does this represent a new process at the Green Mountain Care Board for the determination of the placement of healthcare facilities?
I'm not quite sure how to answer that. I don't,
Okay.
I mean, it's currently they have a responsibility for the HRAF where they identify the goods and services, and I think identify potentially areas where there is not sufficient access to certain goods and services. And then when they receive a CON application, they look at the need for that particular service in that particular location. So as far as identifying specific.
So it's sort of kind of upfront. These are the places. It's just a reversal of the process.
Right, I think it is identifying, potentially prospectively identifying areas of the state or populations that have a need for services and then kind of carving out an exception from the CON because that need had been prospectively determined.
One of the things, part of the argument in finance was the certificate of need, and it went down to buying equipment is for $1.5 million. And if it were good enough 20 years ago, it should hold now. And in those days, I remember Bishka coming in, everybody was buying MRI machines.
Yeah.
And you sprained your ankle,
Yeah,
and then rather than $200 x-ray, you were getting a $2,000 MRI. And in the old days, they would have said, take an aspirin and put ice on it and come back in a week if it's still swollen. So we were trying to limit, and we have, I don't know what kind of imaging machines, but they show up in a tractor trailer one day every 2 weeks or 2 days at CBH, you can see them parked out there. But we would, because once you bought it, then
you gotta
you
use
gotta
it.
pay for it, yeah, and it, once you paid for it, it's a cash cow. So we were dealing in that scale, and they said, so why not? And I said, what's changed in the last 20 years is that our small rural hospitals are on the verge of going, well, anything that competes with a hospital, we're gonna deny. No, but our rural hospitals are in such fragility financially. We need to be very careful. And we may need to look at, as part of this, the CON to reflect the new reality in the financial health of hospitals. Because the way you survive is you become part of a bigger network. But we already have an issue with one behemoth hospital.
Yep.
Who is now offering insurance plans
And that's a problem right now we're hearing about,
yeah, and survival, they, we could end up with one, maybe two hospital networks controlling this state. And that's what's happened in other states.
Yeah.
And there's issues with that, but, we need, if we do nothing, something will happen.
Well, speaking of doing nothing, if section 4, we're just, any questions for Jen on this proposal amendment?
Just,
So go ahead, and then I want to ask a question about the underlying.
so Jeff, I was thinking that if we have section 5, as it appears in the amendment, does that then cover what we need as far as CONs for birth centers? Do we need section 4 that pointedly says that the birth center needs a CON? I mean, it seems to
That's the
me that,
underlying rule. The underlying rule is they're a new medical facility, they need a CON. The exception is Senator Hardy's exception. So they need a CON unless they're in an area or serving a population that needs the service.
but that underlying assumption comes from the bill as proposed that has birth centers in it. Do birth centers need a CON under current statute? Senator Hardy has consulted with Green Mountain Care Board's counsel, and they say it does. I've heard that it doesn't.
I don't think I can give you a definite interpretation. It's really, I mean, if the Green Mountain Care Board's council believes that it does need a CON, they're the ones who will be making the decision. I can tell you that the statute says a healthcare facility other than a hospital shall not develop or have developed on its behalf a new healthcare project without issuance of a CON by the board. And then it defines, but I should say, it says for purposes of this subsection, a new healthcare project includes the following. And that's what we've been looking at about the $1.5 million jurisdictional trigger, but it doesn't say, so as I understand the board's position, they read that first sentence, a healthcare facility other than a hospital shall not develop a new healthcare project without issuance of a CON as being, as describing a new healthcare facility to be opened regardless of the jurisdictional trigger that would otherwise come in at the 1.5 million. And I think that on its face, that seems like a reasonable reading of the language. So it says healthcare facility other than hospital shall not develop or have developed on its behalf a new healthcare project without issuance of a CON. It gives some inclusive definitions, but not exclusive definitions of what constitutes a new healthcare project. So I think I understand the board to be saying they have authority to require a CON under the first sentence, which I think seems accurate as I read it. But again, it will depend on their interpretation. And if somebody disagrees with that, whether there's litigation on the subject.
Okay, so I think what we'll do is we're gonna let this one just sort of percolate. I call it reflection. We're gonna have a little reflection on this, and then we will come back to this at some point, but I think we should move on to H 720, which is next on our agenda. So it always gets more confusing than it was, but if there is an interest, I think let's think about this, and then we'll come back and I will ask you if you would like to take testimony on the proposed amendment, because it is significantly different from what different from what's in the bill.
Do you want me to stay? Will you be coming back to this, or are you?
We won't go back to it today.
Okay.
Yeah, but thank you so much for scooting down here. Really appreciate it.
Thanks for your patience. The PDM bill is on the notes for us.
Oh, good
That's
luck.
what
So, Ellen, do you want to add anything?
I wasn't here for that bill.
You?
It said 7:20 on the agenda, so I showed up for 7:20.
Yeah.
I stayed for the meeting.
The 720, does that have a?
Well,
Oh. Well, Katie is not here yet, and
I
we
don't
have,
think I prepared the sheets.
is Teresa with?
They're all coming, but it'll take a minute.
All right, we'll just take a minute. We'll just take a little breather.
Katie is here.
Oh, good. Good morning.
Have we been live during that last?
Yes,
Yes.
that's a good thing. I think people need to understand
I
where we are.
think they do.
Yeah.
That process is important,
Yes, absolutely.
and if you can violate the process for something you want, that means the next guy can violate it for something you don't want.
Exactly.
And that's very dangerous.
Representative Wood, welcome.
Good morning.
Why don't you sit right here?
Okay.
You're with
I
us.
can watch finance on Friday live.
Oh, it was fun. We're a little bit late in our work, but we look forward to hearing from you.
No worries. Hi. Good morning, everyone.
Good morning. So why don't you introduce yourself to the record,
All right, I was just,
and then we'll listen to your comments on H 720. And because we are a little bit behind, we may not get into a conversation at this point. And we will, if we may actually ask to have you come back another time.
you know where to find me, Madam Chair.
We will.
Okay, for the record, Representative Teresa Wood from House Human Services. And if I haven't been joined already, I will be momentarily by Representative McFawn, who also reported the bill on the floor with me. H 720,
Can I
yes.
ask for just a second? Do we have the bill? I see as introduced and then the two amendments. Do we have the bill as passed out of your committee?
The
I can
only,
help with that.
We have everything that is here.
yeah,
So you have the Human Services Amendment, and then,
which just reflected a sunset date for the
These
committee.
are too little
and
amendments.
Katie, would you clarify what we have?
Sure. So H 720 is still on the floor for third reading, so you don't have a combined integrated copy yet. So you have the bill is introduced. It was a committee bill. That's why you're looking at the bill as introduced. Then you have the appropriations amendment, and then you have an amendment offered by the members of Human Services.
So the as introduced bill is as close to whole as, and because the amendments are pretty small. Okay.
Yes.
Great, thank you.
Yes, and I can address the amendments as well.
Okay.
Yes, you are ahead of the game down here in the Senate. We haven't even passed third reading yet, but
It's okay.
I have no doubt that we will. So H720 is a bill that we took extensive testimony on in the House. You may have started hearing from, or you may have been hearing over the course of the last several months from individuals with developmental disabilities, their family members, the designated and specialized service agencies. And really what we have, like I'm sure that you have heard in other circumstances, is a system in significant crisis right now. Because it's a smaller group of people, you know, individuals with developmental disabilities make up about 16,000 Vermonters in the state. And only about 29% of those individuals receive services from the state via our designated and specialized service agencies, so about 4,600 people a year. That number, by the way, is double the number of people who ever passed through the Brandon Training School. I just thought that was a interesting factoid when I was doing my research. So in 1 year, we served double the number of people that ever in the 78-year history of the Brandon Training School were ever served there. When we closed the Brandon Training School in 1993, we all as a society made promises to individuals and their families. You know, frankly, we have been inconsistent in keeping those promises. This bill hopes to start to reestablish the trust in the community for our state government, for individuals and their families who are seeking better choices that they believe fit their families better, and for some additional oversight, frankly, by the legislative body when it comes to payment reform and conflict-free case management, the latter of which is a federally required change. And those last two things will change the entire system. They'll impact everybody in the system, the families, the providers, and there's a huge amount of angst. I can't really understate that right now. We feel that that will require some additional review by the legislature prior to the department hitting the switch and saying, these are all a go. And I will tell you up front, the things that the department agrees with and the things that the department does not agree with, just so you know what you're headed into. So the residential program developer, a limited service position that's established here, there are funds included in the FMAP bump. No, excuse me. They have indicated that they're willing to use funds in the FMAP bump. Likewise, with the $500,000 that's appropriated from that for the pilot planning grants, up at least 3, but it could be more pilot planning grants. They also did not say they were against the quality assurance and improvement requirement for annual visits. However, this is, you will see in budget language, the department has asked on its own for 10 new positions in the department. And in compromise with the House Appropriations Committee, they will be allocating 5 of those positions to implement the quality assurance requirement in this piece. You won't see that in their amendment, but that will be in the budget because that's where those 10 positions were requested. So I can tell you that the department is not crazy about that idea. However, our committee and the full House feels that making visits to designated and specialized service agencies once every 2 to 3 years when we're talking about individuals who are very vulnerable is not sufficient, frankly. And we, at one point, our state did conduct annual site visits. And I've been around long enough to know that we actually conducted site visits twice a year back in the beginning of the home and community-based services. So, you know, due to staffing and due to the growth in the program, that was moved to once a year. And then, some of you may remember Challenges for Change.
Oh, yeah.
During Challenges, I know, I hate to bring up bad memories, I'm sorry. But during Challenges for Change, there were a number of positions that were cut. And quality assurance positions were cut. And this essentially, that provision essentially will restore that to what it was prior to the whole Challenges for Change. And so it is the number of positions that you'll see referenced by the department when you have them in. They gave us information, so we use their information. It's 5 positions. It's a team leader, 3 quality assurance reviewers, and a team nurse that reviews the health and safety of those services. So, so the department's, I would say, not crazy about us, you know, reallocating 5 of the 10 positions that they requested. They are also steadfastly against the final provisions in the bill about seeking the General Assembly's approval prior to implementing what's going to result in massive changes to the system. Other than that, they are supportive of the concepts in the bill. And this is something, as I said, we took some, I have to say, very emotional testimony from family members, from self-advocates themselves, from allies. I can tell you everybody else is supportive of all of the things that are in here. So the advocates, the self-advocates, family members, the providers, they are all on board with that. The department, not so much with a couple of the provisions. So just wanted to be transparent about that. But we felt extremely strongly about it and have kept those things in. I also want to give a shout out to our ledge council, because during testimony, the Agency of Human Services and Dale had indicated that this would be setting a bad precedent around prior approval, and our very apt ledge council was actually able to find examples of where that is not, this would not be setting any precedent.
I can think of some.
Yes.
Yeah.
But that will be their argument.
Well, we'll hear from them.
Yes.
I appreciate your giving us the heads up on that.
Everybody else, you will hear support from the bill for. I mean, they may have.
We're
little
already
tweaks,
hearing it.
but- Oh, okay.
Yeah, we're being deluged.
Yeah, they're a very active group of family members, and we have had. I will say that it's like I said, it's been an emotional bit of testimony, and for the first time in a long time, people are feeling like somebody is listening to them.
Yeah.
That is part of our job here.
So Senator Hardy has a question for you.
Yeah, thanks, Representative Wood. I haven't actually had a chance to look at the language in the bill, so this is just based on what I'm hearing out ethers. But there's $500,000 in the bill. Is that in the budget or in the actual?
That is in the bill.
It is in the bill.
Mhm.
And those are for planning grants? Is
Yes.
that right? For creating facilities, basically?
No, I wouldn't say facilities, for creating residential options,
Options, okay.
which may or may not be a facility.
Is there any identified sort of ongoing funding or potential for ongoing funding once some projects maybe are established?
That is part of the required report, that they are required to come back to us. We changed the date, I think it's April next year now, with implementation steps and resources required in order to implement. One of the things that I think is interesting about this is that, as you all know here, the services for people with developmental and intellectual disabilities in the state are nearly 100% covered by Medicaid through global commitment. So there are likely resources, if for instance some sort of group home or some sort of shared apartment kind of situation, we're deemed to meet the requirements that are set out here, then there would need to be some additional partners. The home and community-based services waiver does not pay for real estate. And so it's one of the reasons that we have inserted the residential program developer, because that person will need to be a person who is linked in with private and public housing folks, through the land trust, through VHCB, through all of those different areas. And that person will sort of be the linkage to the additional resources that would be needed even beyond the home and community-based services money.
Okay.
And that money, the Agency of Human Services had included in their spending plan money for a consultant. So they expected to contract that out. We differed with that approach because we felt like there was going to be needed more direction from the state and a closer connection. And so we inserted a limited service position for that purpose. And that is we did not, however, insert the appropriation language, and that is what the House Appropriations Amendment does. It inserts $102,000 from the FMAP bump into this bill.
So what I'm going to suggest is that we give, I'm going to turn to Representative McFawn, who's here, but then I think we'd like to go through the bill briefly with our ledge counsel, and we will, as we get into more conversation, it might be important for you to clarify how your committee made the decisions that it did. So thank you. It's been very thorough. Appreciate it. Representative McFawn, did you want to add a comment at this point?
I think that the representative did a wonderful job explaining the bill. I just want to interject a little bit of my own personal experience. Over the past couple of years, I've been meeting with families and listening to their stories, and frankly, some of their stories were unbelievable. And I told them that. I couldn't believe how they were treated and how they would go to meeting after meeting and appeal after appeal and come back with piecemeal services and not really get the services that their adult child was eligible for. And one of the families asked me to go on a journey with them to try to get services to their adult child. And I can tell you that I heard with my own ears as they went from agency to agency and got turned down or got piecemeal services for their son. And this bill and what we're going to do and what we're already started doing with the agency is going to go a long way to solving those problems that were brought up by the very people that have experienced them. And I've spent a long time with these families, and it's time that we do something about it. We listened to them, we heard what they had to say, as Representative Wood said, and we need to do something, and we need to do it quick. Decisions are being made on a plan of service that's 5 years old and hasn't really been updated in the last 5 years as is required. So with that, I hope your committee can support this bill. Thank you.
Thank you. Thank you very much for that. We have been getting emails about the bill with some pretty concerning stories that sounds like you've also heard. So thank you for sharing with us.
Yeah.
So I think at this point, we're just going to move to our ledge counsel. And Katie, we have 12 pages of bill and probably 12 minutes. So that's where we are. We will come back to it, but it would be helpful to get a sense of what is in the bill.
Sure, happy to help. Katie McGlynn, Office of Legislative Counsel. So that leaves me with a page a minute. Okay.
No problem.
That's new. That's different from 10,000 or 2,000.
I'll give you a high level and I'll come back and we can maybe look at the details another time. So I'm assuming you have the document pulled up on your own screens. Okay, great. Okay. So I'll skip to page 2. There is a legislative intent section, and for the interest of time, I might just skip over legislative intent and go to the system of care plan in section 2. The system of care plan, this is an existing law that every 3 years the department has to develop a plan called the system of care plan that determines the nature, extent, allocation, and timing of services for individuals. Right now, in existing law, the plan is sort of bifurcated. And so some portions of the plan have to go through the rulemaking process and other portions of the plan don't have to go through that process. So what this section does is removes the rulemaking requirements so that the plan is no longer bifurcated in that way. And that's the changes you're seeing in subsection A, C, and then there's new language in subsection F. And this has to do with the DALE requiring an extension to the system of care plan. And this specifies that it shall submit a written request indicating the anticipated completion date to the 2 committees of jurisdiction at least 2 months prior to the expiration of the existing system of care plan, and that the request for an extension may be granted upon approval of both the chairs of the 2 subject matter committees. So in other words, this just gives a process. If the plan is not going to be updated within the 3-year window, this gives a process for how DALE is to request an extension and a process for the legislature approving that extension. So that brings us to page 4. I'm on section 3. Section 3 has to do with the quality services review. What you're seeing in section 3 is something that should be sort of familiar to you because we did it in one of the Senate bills that's going over to the House. But that is where broadening the title of one of the chapters and creating subchapters underneath it. So currently we have the Developmental Disabilities Act. Nothing in that act is substantively changing. Instead, we're just changing that title to be supporting individuals with developmental disabilities and creating a new subchapter called Developmental Disabilities Act. And then underneath that, you'll see that there are sort of conforming changes to change the word chapter to subchapter. So there are several sections that only change the word chapter to subchapter, nothing substantive. Then we get to page 6, where we are creating a new subchapter, supports to individuals with developmental disabilities. And the actual new substantive change in this chapter is the addition of section 8741, quality services reviews. So the department is to perform at least annual on-site quality assurance and improvement visits to the designated and specialized service agencies and other contracted agencies. The department shall, at a minimum, assess quality of services provided, including health and safety in accordance with personalized service plans for the individuals served. So that's the language that Representative Wood was referring to with the annual site visits. And then in section 4, we have the creation of a new position. This is the residential program developer. It's a limited service position within DALE. And then we have a list of the duties of this person, why this position is being created. So first, to expand housing and residential service options for individuals with developmental disabilities in accordance with federal home and community-based service regulations. Second, assisting individuals with developmental disabilities and their families navigate publicly and privately funded housing and residential service options. Subdivision 3, investigating public and private funding opportunities for residential program development of individuals with developmental disabilities. Subdivision 4, working with individuals with developmental disabilities and their families and allies to identify potential models for residential services. Subdivision 5, developing requests for proposals and identifying at least 3 pilot planning grants for different regions of the state focused on the needs identified in those regions. And we'll be looking at the pilot planning grant language in more detail below. and then working with appropriate designated and specialized service agencies or other providers to implement the selected pilots. And then the House Appropriations Amendment would be inserted here as a subsection B in this section, and that is the funding, the 102,000. So hopefully the next time we see this, we'll have that all integrated. So next is section 5, the language on the pilot planning grants. In subsection A, Dale is directed to work with the Vermont Developmental Disabilities Council and a statewide self-advocacy group to review housing models in other states for the purpose of informing the pilot planning grants developed in subsection B. And then in subsection B itself, we have 500,000 appropriated in fiscal year 23 to Dale from the FMAP bump to develop housing and residential service pilot planning grants to at least 3 regions of the state in partnership with designated and specialized service agencies for individuals with developmental disabilities and their families. And the department is to issue a request for proposals seeking entities to develop these planning grants with not more than 1 grant per designated agency catchment area. Specifically, the grants are to reflect the diversity of needs expressed by individuals with developmental disabilities and their families, including individuals with high support needs who require 24-hour care and those with specific communication needs. They must be consistent with the home and community-based services regulations. They must include new service-supported housing models and also include a vision statement, the number of and description of support needs of individuals with developmental disabilities anticipated to be served, a draft budget, and an implementation plan. And then all of this work with regard to the planning grants is to be guided by a steering committee, which I'm on page 9, subsection C. It directs the department to convene this steering committee to provide advice and guidance as it develops these grants. And then we have in subdivision C2 a list of members, 3 individuals with developmental disabilities appointed by the Green Mountain Self-Advocates, 2 family members of individuals with developmental disabilities appointed by the Vermont Family Network, 2 advocates who are either individuals with a developmental disability or a family member of an individual with a developmental disability appointed by the State Program Standing Committee and the Advisory Board that's within the Developmental Disabilities Act, 2 representatives of the DAs and SSAs appointed by the Vermont Care Partners. And then in subdivision 3, this just says that this committee has the assistance of Dale. The amendment offered by House Human Services creates a 3A and 3B here, and 3B sunsets the steering committee. I don't have it pulled up. I think in 2024.
January 1, 2024.
24, thank you. And then in subdivision 4, this just directs that information that's provided to the steering committee shall be in plain language. In subdivision 5, members of the steering committee are entitled to per diem compensation and reimbursement. And the monies for this are from monies appropriated to the department. And then in subsection D, we have a report back by April 15th of 23. The department is to submit a report to the committees of jurisdiction describing the pilot planning grant selection process, the implementation plan, and any resources necessary for implementation of selected pilots. Okay, I'm page 10 and I have 2 minutes left. So I think I'm doing well here. Section 6. This is language about the payment reform and conflict-free case management. And you can see that this section is divided into 2 subsections. So subsection A is dedicated to payment reform. Subsection B is dedicated to conflict-free case management. In subsection A, prior to implementing system-wide payment reform impacting individuals with developmental disabilities, their families, and DAs, SSAs, Dale is to seek approval from the General Assembly. At a minimum, the following is to be included in the payment reform process. First, in addition to any standardized assessment utilized by the department, a process for consideration of additional information relevant to the life circumstances of of service recipients or applicants. Secondly, in addition to any standardized rates or rate ranges developed by the department, a process for consideration of budgets to reflect the individualized support needs of service recipients or applicants. And lastly, at the top of page 11, a process for evaluating the fiscal and service impact on individual service recipients and the DAs and SSAs. Then we switch gears in subsection B to talk about conflict-free case management. Prior to implementing the federally required conflict-free case management system, the department is to seek and consider input from a variety of stakeholders, including individuals with developmental disabilities, their families, the DAs and SSAs, and other providers and advocates, and seek approval from the General Assembly. As part of the changes necessary to come into federal compliance, consideration is to be given to performing initial clinical eligibility and service planning with the department. And then that brings us to section 7. I'm out of time, but I have one section to go. Is it okay if I just?
Keep going.
Okay, great. So then we have the Home and Community Services spending plan amendment. So this directs AHS to seek and amend its federal home and community-based service spending plan to enable Dale to use the FMAP bump to fund the new program developer position created in section 4 and the pilot planning grants in section 5. And then we have our effective dates. This section and the language about the system of care plan is to take effect on passage. And then the rest of the bill is to take effect on July 1, 2022. And that's because the system of care plan is being worked on right now. So this lets the changes to the plan take effect as soon as possible.
Good work. Thank you. Well, that was the flyby. I think we'll, as we take the bill up again, we're going to have to go through it, and we'll be gathering testimony so we can understand the basis for what's here. So thank you, Katie McClin, very much. Appreciate it. And thank you both Representative Wood and Representative McFawn. We are over time, so we're going to